Hi, everybody. This is Dr. Britt Talley Daniel, MD, and I'm a neurologist and headache doctor. And today I'll be podcasting on the subject of non-narcotic treatment of migraine in the emergency room. Migraine is a common problem, affecting 12% of all people, as 25% of women and 6% of men. It's a very disabling neurological condition, and many persons with bad migraine attacks end up in the ER. In years past, many of these migraine patients were given IV opioid treatments, which was not that successful for analgesic or pain-killing help and was very sedating. Usually in the emergency room, the patient would have a brief general medical exam, including vital signs, and sometimes general labs such as chemistry and blood counts, and sometimes a CAT scan of the brain would be done. Most of these patients would be referred to a headache neurologist for an outpatient visit after their ER visit. However, now in the days of COVID, that might be a new teleneurology visit. Many of these patients would be given a low dose of a butalbital analgesic combination drug like fiorinol to get them to their neurology visit. The problem would be that the open narcotic wouldn't help their presenting headache very much, and many patients would return to the ER because of continued pain and disability, so that ER doctors are always looking for other drug treatments. This article is about the successful use of non-narcotic drugs in the ER setting. IV prochlorperazine and diphenylhydramine are better than opioid treatment for migraine in the emergency room. Conclusions. IV hydromorphone is substantially less effective than IV chlorperazine for the treatment of acute migraine in the emergency department. It should not be used as first-line therapy. Friedman et al. Wrote in Neurology in 2017 on the subject was randomized study of IV prochlorperazine plus diphenylhydramine versus IV hydromorphone for migraine. The objective was to determine outcomes among patients with migraine in the emergency department who receive treatment. The study was conducted in 2 emergency departments in New York City. Patients who met international criteria for migraine were eligible for participation if they had not used an opioid within the past several months, and the doctors were all blinded to treatment. The results of this was the trial was halted by the Data Monitoring Committee after 127 patients had been enrolled. The primary outcome was achieved in the prochlorperazine arm by 37 of 62 participants and the hydromorphone arm group by 20 of 64 patients. Conclusions. IV hydromorphone is substantially less effective than IV prochlorperazine plus diphenylhydramine for the treatment of acute migraine in the emergency department. It should not be used as first-line therapy. Classification of evidence. This study provides Class 1 evidence for patients in the emergency department with migraine. IV prochlorperazine plus diphenylhydramine is superior to IV hydromorphone. Editorial comment from the American Academy of Neurology. One of the many studies showing a certain safe non-narcotic drugs that work better than opioids in the emergency room. Drugs to consider on ER discharge. Butalbital is a barbiturate. It's been banned all over the world in every country except the United States and Canada. It's notorious for causing medication-induced headache and not a good oral drug to give patients after an ER visit for headache. If the ER doctor thinks the patient has migraine, he might write a small number, like number 10, of his favorite triptan, advising patient to treat early and only use 2 treatment days a week until he sees the neurologist. Also, dihydrogodamine, DHE, given as Migranol nasal spray, or timolol eye drops would be reasonable substitutes. Hopefully, this study will impact emergency room practice to provide better relief for migraine patients who present to the emergency room. So it's the end of my dictation on the subject of non-narcotic treatment of migraine in the emergency room. I hope that all you folks who have migraine do not end up in the emergency room. You have good treatment. God bless you all. Please click on subscribe down there so we can follow each other. Thank you for listening. Look for me on other sites for discussions on migraine. I've got you on Podbean. I'm on Spotify and iTunes. God bless all you persons with migraine, and I will see you all on the next talk.